Classification of Chinese herbs. Lugabrasi swims with the fishes. The classification of various items under study marked the beginning of science and has continued into modern times. In botany, for example, we classify plants into different families to further our understanding of them. Chinese herbs are as old as Chinese history, and the ancient Chinese classified herbs according to their basic actions. In other words, what they could do to the human body. There are a total of 20 major classifications within Chinese herbalism today, each of which represents a number of important actions. Class of herbs to induce perspiration. The herbs that fall under this classification have one thing in common, namely that they can induce perspiration, which is their major action. For this reason, an illness that can be alleviated by perspiration can be treated with this class of herbs. Conversely, a patient with an illness that can be intensified by perspiration should avoid this class of herbs. If, for example, you catch a cold, herbs in this class would benefit you, because in order to overcome the common cold or the flu, it is necessary to induce perspiration. On the other hand, if you suffer from night sweats, excessive perspiration, or chronic diarrhea, which will already have drained off a great deal of water from your body, you should avoid herbs in this class as much as possible. Herbs that induce perspiration are divided into two subclasses. Herbs for symptoms characterized by cold sensations, namely Chinese ephedra, lily-flowered magnolia, and purple perilla. And herbs for symptoms characterized by fever, namely hare's ear, kudzu vine, and mulberry-leaved chrysanthemum. Thus, if you are suffering from the common cold with chills, the first subclass of herbs should be used. But once you display high fever, the second subclass is recommended. All classes of herbs have specific uses and also entail a few measures of precaution. The major uses for the class of herbs that induce perspiration are the common cold and the flu, as well as many related symptoms such as headache, fever, pain in the body, and a cough. In addition, this class of herbs is also frequently used to treat bronchitis, bronchial asthma, measles at an early stage, acute glomerulonephritis, and acute rheumatic fever. And acute rheumatic fever. There are 4 measures of precaution using this class of herbs. First, herbs in this class are not good for chronic symptoms involving the internal organs. This is probably because each symptoms cannot be treated simply by inducing perspiration, and probably because a prolonged consumption of these herbs will weaken the body, which is not desirable for patients suffering from chronic diseases of the internal organs. Second, symptoms that have already dehydrated the body, such as vomiting, diarrhea, and bleeding, should not be treated by this class of herbs. Third, after taking this class of herbs, it is desirable to stay calm and keep warm so that perspiration will occur to a suitable degree, being neither excessive nor insufficient. Fourth, when a rather weak patient, such as an older person, takes this class of herbs to heal an illness, it is wise for him or her to consume some herbs under the classification of herbs to treat deficiencies, namely class 16. From the point of view of modern medicine, the class of herbs to induce perspiration performs 2 basic functions. First, the herbs in this class can expand blood capillaries in the superficial region of the body and activate the secretion of the sweat gland in order to reduce fever, get rid of toxin, inhibit bacteria, and strengthen the body's ability to ingest and destroy bacteria and defend itself against foreign invasion. Second, this class of herbs can increase glomerular filtration to remove excessive water in the body. Class of herbs to reduce excessive heat inside the body. Many diseases are due to the presence of excessive heat inside the body. This class of herbs is capable of reducing excessive heat inside the body and is used for those diseases that are mostly characterized by inflammation or infection. This class is divided into three subclasses: herbs to reduce the heat of fire, namely chorizo, cork tree, gold thread, purslane, salvia, skullcap, and windweed; herbs to reduce heat in the blood, namely Chinese, pulsatilla, and white rose; and herbs to reduce heat and detoxicate at the same time, namely Asian dandelion, chicken bone grass, Chinese violet, Japanese honeysuckle, and puffball. The concept of heat is a unique concept in Chinese medicine, as heat is believed to be the cause of many so-called hot symptoms. Herbs that can reduce heat of fire are used to treat acute inflammatory and infectious diseases. Because acute diseases can be said to attack as fast as fire burning down a building, such acute diseases include encephalitis, which is inflammation of the brain, pneumonia, which is inflammation of the lungs, and acute bronchitis, which is inflammation of the bronchial mucous membrane. Herbs that can reduce heat in the blood are used to arrest bleeding, such as with nosebleeds, discharge of blood from the mouth, and vaginal bleeding. Herbs that can reduce heat and detoxicate simultaneously are normally used to treat inflammatory and infectious diseases that are suppurative, such as many skin diseases, mumps, lymphangitis, mastitis, and appendicitis. A few measures of precaution should be taken in using this class of herbs. First, symptoms related to the common cold or the flu, into fever, or excessive heat in the body due to constipation should not be treated by this class of herbs. Second, herbs in this class tend to be bad for the stomach because they are not easily digested. For this reason, they can be taken with the class of herbs for promoting digestion, if necessary. Class 9. Third, this class of herbs can dehydrate the body, and for this reason they can be taken with yin tonics, which consist of herbs to treat yin deficiency. Class 16. From the viewpoint of modern medicine, the class of herbs can be used to heal inflammation, counteract bacteria, arrest bleeding, reduce body temperature, increase urination, and activate the ureter, which explains why such herbs can treat urinary stones effectively. Class of herbs to counteract rheumatism. Most of the herbs in this class can be used to relieve pain. They are especially effective for the treatment of muscular pain and pain of arthritis and rheumatism. The herbs included under this classification are Chinese clematis, mistletoe, and slender acanthopanax root bark. Arthritis and rheumatism at the beginning stage should be treated by herbs in this class along with those in the class to induce perspiration, class 1. As these illnesses enter the intermediate stage, they should be treated by this class of herbs along with the class of herbs to promote blood circulation, class 12. The Chinese believe that rheumatism is caused by three factors, or any combination of them. These three factors are wind, cold, and dampness. When rheumatism is caused by wind, the pain travels around the entire body, which is why it is called wandering pain and it is difficult for the patient to pinpoint. Chinese clematis and mistletoe are particularly good for arthritis and rheumatism caused by wind. When rheumatism is caused by dampness, the pain will stay in a fixed region so that the patient can easily point to where the pain is occurring. Slender acanthopanax root bark is especially good for this type of rheumatism. Class of herbs to reduce cold sensations inside the body. This class of herbs is used to warm the body in the treatment of ailments associated with cold sensations inside the body, such as vomiting, diarrhea, cold abdominal pain, cold stomachache, and poor appetite. Some people feel a need to vomit because of cold sensations in the stomach, and others develop diarrhea due to cold sensations in the bowel. One herb in this class is called Evodia. It is a warm herb and is frequently used to stop vomiting and relieve cold pain. If you have a cold symptom such as vomiting or diarrhea and you have also caught a cold and are not completely recovered, you could take this class of herbs along with the class of herbs to induce perspiration, class 1. As herbs that reduce cold sensations inside the body are warm and dry. They are not to be taken by people with a heart disease or by those whose water content in the body is in short supply. From the standpoint of modern medicine, this class of herbs can improve the function of the cardiovascular system, increase heart action, excite the vasomotor center and the sympathetic nervous system, elevate blood pressure, and improve blood circulation. In addition, these herbs have been found to improve the hypophyseal function and the function of the endocrine glands, as well as elevate the effects of the neurohumoral regulation for better coordination among various vital internal organs that will in turn improve metabolism. Class of herbs to reduce dampness in the body. When dampness accumulates in the body, it could cause many ailments, including abdominal swelling, swelling of the stomach, puffiness in the limbs, diarrhea, jaundice, and a few skin diseases. This class is divided into two subclasses: herbs to transform or absorb dampness, namely Buryo, gray tractalodes, and Korean mint, and herbs to promote urination, namely Asiatic plantain, corn grass, and evergreen artemisia. To transform dampness means to stimulate the action of the spleen so that it can speed up the excretion of water from the body. The Chinese believe that one reason why dampness continues to accumulate in the body is that the spleen is not strong enough to make water flow. The herbs that can transform dampness are able to correct the conditions of the spleen. Another way of getting rid of dampness inside the body is through promoting urination. The herbs for promoting urination are often used to treat many urination disturbances and related symptoms, such as edema, stones in the urinary system, and acute nephritis. In addition, many obese people have accumulated an excessive quantity of water in the body, which is why this class of herbs is often used for weight reduction. Along with reducing dampness in the body, this class of herbs at the same time can also reduce yin energy in the body. For this reason, people with dry conditions and thin and weak people should not use this class of herbs. From the point of view of modern medicine, this class of herbs has been proven effective for cardiac renal edema, nutritional edema, prostatomegaly, urinary retention, and other symptoms associated with gastroenteric disturbances, such as nausea, vomiting, poor appetite, and diarrhea. These usages are attributed to the following three functions performed by this class of herbs. First, this class of herbs can enhance the functions of the heart, lungs, and kidneys. Second, it can regulate the functions of the stomach and the intestines to stop many digestive disturbances. And third, it can adjust the neurohumoral regulation, which contributes to excretion of excessive water in the body. Class of herbs for lubricating dry symptoms. A dry disease should be lubricated. Dry diseases can be either internal or external, and this class of herbs is used for treating both categories. Internal dryness may give rise to dry skin, constipation, discharge of dry and solid stools, discharge of scanty urine, thirst, dry throat with cracked lips, and sleeplessness. External dryness may give rise to absence of perspiration in hot weather, blood and sputum, dry cough, dry nose, and dry skin. This class of herbs is divided into three subclasses. The first subclass consists of herbs for lubricating the lungs. Herbs in this subclass are used to treat dryness of the lungs and yin deficiency of the lungs, which can manifest in the following ailments: loss of voice, coughing up blood, dry cough, atrophic rhinitis, the common cold, influenza, bronchitis, diabetes insipidus, throat pain, dry nose and throat, and tickle in the throat. The second subclass consists of herbs for producing fluids and strengthening the stomach. These herbs are used to produce fluids in the stomach, mostly for the treatment of yin deficiency of the stomach, manifesting as diabetes, mellitus, morbid hunger, dry lips, or stomach ache. The third subclass consists of herbs for watering the yin, to increase yin energy in the body, as in watering a plant and lubricating dryness of the intestines. These herbs are mostly used to treat yin exhaustion, dryness of the intestines, and dry constipation. Herbs in this class can slow down movements inside the body, including energy circulation, blood circulation, and digestion. So for this reason, those with poor energy circulation, poor blood circulation, or chronic indigestion should avoid this class of herbs.